Hi, I'm Dr. Gus Stern at Maryland Vision Institute. We've determined that you have a cataract today, and we'd like to improve your vision by removing your cloudy lens that's inside of your eye and putting a clear lens in its place. Your eye is like a ball. In the middle of it is the lens of the eye. Each year you get older, the lens becomes a little more cloudy, and when it gets cloudy enough to where it's blurring your vision, we remove the lens and put a clear lens in its place. You'll be here for about an hour and a half on the day of your surgery. The surgery itself takes less than 10 minutes. When you come out that day, your vision will be blurry, and it'll start to clear up the next day. It could take 1 to 2 weeks to fully clear in. We generally do your second eye about 1 to 2 weeks after your first. You'll be putting drops inside your eye for about 3 weeks after. We don't want you lifting more than 20 pounds for about a week. We will give you a clear shield to wear over your eye at night so you don't accidentally rub your eye in the middle of your sleep. You can take a shower, but just please turn your head in the shower and wipe your face with a washcloth. And you can resume normal activities, except for we don't want you to have any jarring running, but you can use a light treadmill, an elliptical, or a stationary bike. We do offer various options at Maryland Vision Institute. The first option is laser-assisted cataract surgery. We generally recommend that because it's a little more accurate and gentler on your eye. The laser takes apart the lens prior to us entering your eye. When we do go in to remove your lens, it's a much gentler process. The second options that we have are possible different lenses to put inside of your eye. The first lens is a toric lens, which will correct for astigmatism. Not all patients qualify for a toric lens, but if you do qualify for an astigmatism lens, it's generally because you have astigmatism greater than 1 diopter or 1 unit of astigmatism. In that particular case, we may recommend the toric lens. If you are a candidate for the toric lens, we do recommend it because your vision tends to be much better as a result after surgery, especially since we correct astigmatism inside of the eye. The vision tends to be of a more consistent quality than if we were to correct it with glasses. The second option that we have is a multifocal lens. The standard lens, which we put inside of your eye, which works really well, lets you see at distance, but you will have to wear glasses for up close vision. So we do offer a multifocal lens that lets you see both at distance and up close without glasses for about 90 to 95% of your activities. So if you're the type of person who would enjoy not wearing glasses, then that might be the lens for you. Not all patients qualify for that lens, so we'll go over which lens would be best for you. On the day of surgery, you'll arrive generally about 1 hour prior to your procedure. You'll park near the ambulatory surgery entrance and come in to our waiting room. There you'll check in and have a seat in our ambulatory surgery center waiting room. After that, the nurses will call you back and get you ready for surgery. They will take your vital signs and check all of your paperwork, making sure that it's accurate. They'll check your blood pressure and temperature and inquire about your medications and all of your past medical history. Once all of that is complete, we'll put some dilating drops in your eye and make sure everything is accurate, again, on the paperwork. Then you'll be brought back to the operating room. There we will properly clean your eye with an iodine solution, and once we come into the room, we will drape your eye with a plastic drape to make sure everything is clean and sterile. The surgery will then be performed and we'll bring you back to the same area that we got you ready in the ambulatory surgery center. We call it the post-operative area, after which we'll allow you to recover from any anesthesia that you may have had, have some juice and crackers, make sure that you're feeling well. Then your family member will bring their car around and escort you to your car, and you'll go home from there. After meeting with me today, you'll meet with the surgical schedulers who go over your date of surgery and the drops. They will also go over the laser-assisted cataract surgery, the premium lenses, and any other questions that you may have about your surgery. Prior to leaving our ambulatory surgery center, the nurses will go over all post-operative instructions with you, and about a half an hour to an hour after your procedure, our nurses will typically call you and make sure everything has gone well with your procedure. We typically will see you 1 day, 1 week, and 1 month after your cataract surgery. And those appointments will be scheduled along the way. Thank you so much for coming to Maryland Vision Institute. We're excited to have you for your cataract surgery. We really think that this will be a beneficial surgery for you and get you seeing a lot better than you're seeing now. And we look forward to meeting you and working with you.